As members of the TTUHSC Amarillo community prepare for this year's cancer screening and information fair, we want to take some time to talk about the importance of getting regular cancer screenings. Today, Luz Santos joins us today from the TTUHSC Breast Center of Excellence to talk about breast and cervical cancer screenings and why staying on top of these is so important for a person's health. Thanks for being with us today. I want to start off with breast cancer. It's the second most common cancer among women in the U.S. We want to make sure that people out there are well informed about self-care and early detection. What do people really need to be doing, especially now more than ever when it comes to those screenings?
Well, the main thing is to get back on track with those annual screenings. Due to COVID and the pandemic and all the restrictions that were in place with, regular screening visits, we want to make sure that we're starting to get back into that routine, because early detection is what is going to, in essence, save lives, as we say. So we want to make sure that we're getting back into a good routine of that. Aside from the screening mammograms, we also want to make sure that we're scheduling our well women's exams, and a well women's exam is where they would do the manual exam on the breast. So just getting back on track with those yearly examinations, I think is a good way to start.
Absolutely. So let's talk about symptoms, signs people need to be looking out for, maybe that they need to call a doctor about. There are some key kind of components to that, right?
Right. There are some key components. I want to start off with saying, obviously, if you feel a breast lump that hasn't been there before, or if you felt one and it hasn't gone away, that's the number one indication that there's an issue going on that needs to be looked at, even if it's a benign issue. So we want to make sure that we're getting in with a physician or a facility to do an examination on that irregularity. Becoming familiar with one's breast is really important. So we like to ask our patients, or the ladies that we speak with, or when we're out educating in the community, to be sure once a month to take a look at the structure of your breast. Notice any changes or dimpling that could be happening once a month. You want to make sure that you're becoming with what the anatomy of your breast look like. So if you notice something that's abnormal, you'll be able to tell due to your monthly examinations, your self-examinations. It's not necessarily just a manual exam on yourself. It's more, of you visually, becoming familiar with what the normal is for your breasts. So we want to talk about lumps. We want to make sure we're getting those checked out. Self-examinations on yourself to make sure that you're becoming familiar with the anatomy of your own breasts. Irregularities, like things would be like abnormal discharge coming from the breast, dimpling, and changes in the texture of the skin.
What about breast pain? Is that a symptom of breast cancer, something that women need to be looking out for?
Breast pain is not going to be what the top indicator for a breast cancer is. Now, if it's breast pain associated with the breast lump, then yes, we definitely want to make sure that we're getting that examined and checked out by a professional. But breast pain itself, especially whenever you're starting to, older in age, or barely starting to have like menstrual cycles and things like that, breast pain has a lot to do with association to your menstrual cycles or your hormonal changes as we get older. So what doctor has recommended in the past from our clinic is that you take some ibuprofen, and you take flaxseed oil. Warm compresses also help, or it could be also an ill-fitting breast. But we don't want people to be discouraged and not call us. If you're experiencing pain, call us and talk to us, and we'll talk to you more about it and get you some good information about what is normal and what's not.
Absolutely. So risk factors of breast cancer are also really important things to know. And there are genetics, age, things like that do play an important role in breast cancer occurrence in women and men, for that matter.
Yes, absolutely. Hereditary breast cancer is something that's big. So what we like to tell our patients is we want women to get a breast exam and mammogram 10 years before the age of their mother or sister's diagnosis. An example, if I'm 40 and I was diagnosed with breast cancer, my daughter would need to start getting mammograms at the age of 30. So there is some cases of hereditary breast cancer. Also, other risk factors are, having given birth to a child later on in age, which has let you have more estrogen in your body, develop in your body over a period of time. And a lot of those breast cancers can be estrogen-based cancers. So having children at a young age, or an older age, starting your periods at a younger age. a family history of breast cancer, also being Caucasian. All of those things are risk factors that we normally don't have any control over. And of course, being born female will also put us at risk as well.
Well, very good information, but I want to now kind of pivot to another thing that you guys handle over at the Breast Center of Excellence, and that is cervical cancer screenings. You help people with risk factors and screenings of cervical cancer. What do people need to know about that topic?
Cervical cancer screenings, cervical cancer is something that's caused by the HPV virus, human papillomavirus. And most women in our lifetime of having sexual activity have had a form of HPV, but there are some kinds of HPV that stick more to the cervix and require you to have some other diagnostics done to treat it. They don't normally, develop into an instant, cervical cancer, but we want to make sure that you're getting your examinations to test for those things early on in age. So we recommend, and this is a recommendation from, our OB-GYN clinic there at Texas Tech by Dr. Baker, is that we get pap smears 3 to 5 years. If you have a history of abnormal pap smears, you want to make sure that you're coming in and getting your pap smear done every single year. Also, having had a HPV diagnosis in the past also increases your risk to have HPV in the future. Having multiple sexual partners increases your risk. Having more than one child is also an increased risk as well. So we want to make sure we're getting the information out. And men are carriers of HPV as well, which there's not an examination for men for HPV, but it's up to us and to take care of ourselves and making sure that we're getting those examinations done yearly if we do have a positive HPV test in the past. So age 21 for pap smears, well women's exams, even though you're not having any abnormal paps or anything like that, you still want to make sure that you're getting in with the doctor to get a well woman's exam, which can include a pelvic exam. You want to make sure that, if you do have an abnormal pap, don't go an extended period of time without coming back and getting another examination done within at least the next year or so.
The thing that's encouraging, though, about cervical cancer is if it's found early, it's very, very treatable, right? And associated with long survival and a very good quality of life. So you want to make sure and get those screenings starting at the age of 21. I also want to talk, though, about the HPV vaccine. What kind of recommendations do you offer there?
We do recommend that both girls and boys begin to get the HPV series of vaccinations, which it's 3 vaccinations that you get at the age. We recommend age of 9, but it can start at 11 all the way up to age 26. Again, I want to reiterate, male and female both. And the reason being is that we're protecting one cervix with the HPV series given to a female, given to a young woman. And then with the male, we'll be preventing that strain of HPV, whichever it protects, from every female he comes into contact for the rest of his life. So in essence, there's a numerous amount of protection that can be had by vaccinating a young man or a young boy. So we want to make sure we're starting that series. And like I said, it's a series of 3. You can get those vaccinations whenever you're going to get your regular immunizations for school. It's not something that's offered, but you can ask for it from your pediatrician. So we really do recommend that to help halt, the progression of HPV.
So if people out there are watching this, they have additional questions, they want to see if they can get screened for either breast cancer or cervical cancer, and they're interested in learning more from you guys at the Breast Center of Excellence, how can they get in touch with you? Where can they learn more information? What are some great resources that you all recommend?
Well, what we have right now in this, media age that we have a really good Facebook page that we like to post information on. You can reach us through messaging on our Facebook page through Instant Messenger. We also have a direct number to the Breast Center of Excellence. That number is 806-414-9556. You can ask for myself or Jennifer. She's another one of our outreach specialists that we work with as well. And when you call, we may even have some availability to be able to help you get some breast screenings, pap smear exams. Just give us a call and we can see if there's anything that we can help you out with. But we're welcome to answer questions at any time about any of those topics. And if there's something that I can't answer for you, I will make sure I find the answer for you.
It's such a wonderful resource. You guys are so knowledgeable and you're so eager to help. And so we are so grateful for you here at TTUHSC. Do want to mention too that we've got the Cancer Screening and Information Fair coming up in mid-April. So we'll have more information available online and on social media for that as it gets closer. But thank you so much for sharing today. We really, really appreciate your time.
Thanks, Megan. Thanks for having us.